This is my first in-person event since the new year when I broke my ankle, unfortunately. So it's brilliant to get out and about, and it's brilliant to be spending the day with people, like-minded people, to talk about community-led health. So delighted to be here. John asked me to say a little bit about the upcoming population health framework. It's largely come about in relation to the work that we've been doing in the Place and Wellbeing programme that both John and I are involved in. So I'm happy to tell you what I know, but I can't say that much for no other reason than I haven't seen a draft and it's still being written by people in Scottish Government. So I can only tell you what I know. Don't see this as me talking on behalf of Scottish Government either. I wouldn't do that. I have pinched their slides, however. And I'll just give you the broad headlines so that you know, because I do think it will be of interest to people here, and I definitely think it's something to watch out for when it's published. So I can say a little bit more about the PAW programme because we have been involved in that, and it is trying to address some of the long entrenched issues for people working in community-led health. What we're trying to do is to get Scottish Government and other senior decision makers and policy makers to understand what those issues are and to better understand the work that you do. So, in terms of the new 10-year population health framework for Scotland, it's very much a high-level strategic approach. It should be setting out the key health priorities for action over the next 10 years. There is recognition that there's a plethora of existing strategies and frameworks. So this particular framework will be building on all of that. So we won't be starting from scratch. And there should be a very, very strong focus on prevention, something I think we would all like to see because we know that community-led health does operate within that prevention space. It's expected to launch in spring 25. It's currently being written, as I said. There has been some engagement and input from other stakeholders, including third sector. It aims to span across government departments, so it is seen as a cross-cutting framework in that regard. And it should be located and contextualised within the wider social and economic determinants of health. And there is an effort to make sure that it's going to be evidence-based. In terms of how that kind of responds to the issues we're interested in, and what we're calling these as kind of areas for action, because it does need to be action focused. I think, 10 years or more on from the Christie Commission and a focus on prevention, we're not where we need to be. So what we've been talking about and feeding into government is greater understanding and recognition of the community-led health approach, the organisations that adopt that approach, to have better influence in the health systems that we operate in, and the partnerships that we engage in at a local level. And of course, it has to be about sustainable resources and stable funding for local level action and services. What we would also expect to see is that our sector is represented within that framework, so it clearly sets out what it's there to do and how it can impact on health improvement, positive health outcomes for people and communities, and also plays a contributory role in tackling health inequalities. So that's what we're expecting to see, but it's very much a watch this space until it's published. We will, of course, circulate information about it when it comes out. Please look out for it because we're interested to see what's in there. So that's what's intended with this 10-year framework. But in terms of the work that John and I and others have been involved in around the Place and Wellbeing programme, the Place and Wellbeing programme has 3 work streams. We're involved in the communities work stream, which makes sense. The other 2 work streams, I should say, are NHS as anchor institutions and something called enabling local change. So in enabling local change, it involves more of our statutory kind of colleagues and partners with a focus on health outcomes in the context of local partnerships like community planning partnerships. Some of you may be engaged in some of that work already. So the aim of the communities work stream is to empower the community and voluntary sector to act locally to complement the actions of the public sector in reducing health inequalities. So it's a nice tidy statement that hopefully sums up what our contribution is. And these are the 4 key themes that have emerged through some engagement with the sector. And I think it will probably make sense. It's been great to have Rachel explain to us more about the research that you've been undertaking, because evidence is a key theme for us to work on, and it has been for years, probably decades, in terms of proving your worth, but also demonstrating the impact of the kind of approach that we take. And so we're all waiting, I think, for the publication of the research, Rachel, because that should be an effective tool that unlocks some of the issues around the other themes, which is having greater influence over health at a local level and the environment that you operate within, and also the thorny issue of funding and resources. So I'm fully aware of the difficult financial experience that our context and environment that we're operating within at the moment. So how much the programme can actually make a dent in the difficult circumstances we find ourselves it remains to be seen. I would say that we've used this as an opportunity to talk at programme board level about those difficulties. And I was kind of encouraged by other members of the programme board recognising these difficulties. So that's one thing. But I suppose the proof will be in the pudding in terms of what we can do to address this short-term funding regime that we all seem to suffer from, and especially encouraged by the research that you were talking about, Rachel, in terms of the importance of that not being the case, that we need longer-term sustainable funding. So one of the things that we've settled on in terms of the year of work ahead and everything that we know so far is a communications strategy, because one thing in terms of achieving this greater recognition and value is that there's lots of people in Scottish Government that don't know community-led health from Adam, quite frankly. So there's something about raising awareness and actually speaking to people about the value of the approach. And so the aim here from a government perspective is that system leaders understand and actively engage in strengthening the contribution that you make and delivering your ambitions to reduce health inequalities and improve health. So the objective for that really is to promote the kind of work that you do and the impact that it has. In terms of the actual objectives, so we're looking to increase knowledge and understanding of sector's role in progressing health equity among system leaders, so the decision makers, the policy makers, the people with clout. That's who we're trying to kind of target here. And we're also looking to seek an understanding of how community organisations can play a role in delivering the population health framework and the actions that it should be concentrating on. And also, trying to identify opportunities to embed knowledge of the sector's contributions. So it's all kind of much of a muchness there, but I hope you would agree that this is an important area of work. When we talk about system leaders, it is something about cutting across Scottish Government. There's also something about persuading and engaging with people across the NHS, which is massive. There is a role, I think, especially in terms of how our partnerships are constructed at a local level in the operating environment. We need to be talking to people in local government, and obviously the people who are tasked with taking this framework forward, so the leads that would sit across all of those 3 spheres, if you like. In terms of implementation, one of the things that we did was engage with the Checks network as we were trying to identify actions that would help the sector. And one of the things that the engagement found was that it would be really helpful at a local level where you work, that people with decision-making capabilities, for people who are working within the system to better promote and support community-led approaches. And we've identified that, or the Checks network identified that, as having champions within the system that can advocate on your behalf, that can unlock opportunities, that can play a role in terms of the type of resources and funding available, and to lead discussions really on how the community sector supports framework actions. So again, it's very action orientated. And of course, these are the kind of champions. They need to come from different places, I think. And of course, I'm sitting in a room full of champions. So there's something about working together with people from different sectors to be able to promote the value again of the approach that you take. And what key messages, you might ask? Well, this is what the Checks Network told us again, and it's something that I absolutely agree with. There's something about locating our approach within the role of tackling the entrenched inequalities that people experience in communities. There should be a direct link to the new framework. We want to talk about the unique role of community organisations in terms of the work that they take forward and how that contributes to wider public health outcomes. There's something about trying to engage within this prevention space, and we want to be talking, we want to be forefronting, I suppose, some of the really difficult issues, funding, as I said earlier, and of course, you know, effective mechanisms like social prescribing. I know that Scottish Communities for Health and Wellbeing have been involved in a really great project with colleagues from Northern Ireland. It's important we don't lose the learning from those types of approaches, and it's important we use them as tools to advocate for the approach. So, in terms of the work that we'll be taking forward over the next year, we'll be looking to identify actual champions, i.e. people with names and roles, so that we can engage them in taking things forward. We're looking to refine audiences and identify places to go to talk about community-led approaches. And of course, we'll be developing the content, and some of that is going to rely, I think, on the work that you're doing, Rachel, in terms of the evidence base for community-led health. And I know that you've been engaging with Scottish Government colleagues in an effort to do that. I should also say, as part of the programme, there has been a literature and an evidence review that will go alongside the Common Health Assets research, so we'll use them as tools to identify and get those champions in place. So I think that's all I can tell you for now. We're going to be exploring some of the kind of policy area within the workshops as we move through the programme today. But I guess in telling you all of that, there might be a question forming in your mind. And I think that question, well, what would preface that question perhaps is, well, that's all very well and good, but we've been here before. You know, some of us have been working on these types of issues for, as I say, years, decades. And so the question that might be forming in your mind really is, what's going to be different this time? And the honest answer is, I don't know. I think, as ever within policy, and it's no for the faint-hearted, to be honest, it's a question that I constantly ask myself in terms of spending your time and engaging in these types of discussions and with policymakers themselves. But I would say, you know, I can only see it as an opportunity to press home the value of community-led health and all of the excellent work that people in this room are doing on a day-by-day basis. We do take the opportunity to promote the approach at SCDC and all things that we do and cutting across various different policy discussions that we're involved in. So I'm going to finish on hopefully a hopeful note, and maybe it's the eternal optimist in me, or maybe it's, you know, trying to move away from being this kind of healthy cynic. But I'm hoping that we might see some progress through these kinds of policy initiatives. And I say it's a kind of watch this space scenario, but maybe we can explore some of the issues and some of what your priorities are to tell policymakers and decision makers as we try to advocate for the approach. So I'll stop there. Thanks very much for listening, and if you are coming to a workshop, we look forward to meeting you and delving further into some of this policy space. Thank you. Is that you? Dawn?